Welcome back to health class. We're teaching health by all means and by any means necessary. I'm your virtual health specialist. They call me the health teacher.
And I'm Dwayne Johnson, aka The Rock, former health educator, now turned technology coordinator. We're here to help you be the best health teacher you can be.
We have a very special guest joining us today, National Content Specialist, co-author of Health Skills for Middle School with Goodheart-Wilcox, health teacher for 15 years, SHAPE Teacher of the Year for Advancement of Health Education, Mary McCarley. Welcome to our show.
Thank you guys. Thank you for having me.
Today we're talking about educators attaining professional knowledge. We're going to ask you a few questions if that's okay.
So, if you're ready,
Yes.
in your opinion, why is it important to provide relevant learning experiences for students?
So I think it's important to define relevant learning experience as the opportunity for students to practice skills. And by providing these high quality, relevant learning experiences, it allows students to practice skills in a controlled, comfortable, accepting environment, thus gaining confidence to transfer these skills beyond the classroom walls. So when in a real life situation, students are able to respond assertively to peer pressure, show empathy to a friend in need, make healthy decisions, set SMART goals, advocate for their family health, and also have the confidence to start the conversation on a difficult topic. We know that providing factual information alone does not lead to behavior change, but skill development can. So by providing relevant learning experiences, students begin to become health literate, which will benefit them for the rest of their lives.
Our Teacher Key Standards want us to attain professional knowledge and provide relevant learning experiences. But for our new teachers out there, this may not be so easy. What would you call essentials for our educators, especially our new teachers, that you can recommend for teaching health education today?
I believe what you're asking me is that what do you really want your students to take away from health class? And I'm not as much worried about factual information because by teaching them how to access valid information, they can get the factual information on their own. What I do want my students to do is practice skills in the classroom so that they can gain confidence to apply these skills in real life situations. I want to empower them to control their health or to take control of their health today and in the future by creating these skill practice opportunities and real world assessments. Some of my students' favorite real world assessments are cooking a healthy meal for their family that's proportionate to my plate, organizing a family fitness workout. One of my favorite performance assessments is a wellness action plan, which is a 2-week behavior change project that allows students to assess their current behaviors and either change an existing behavior that's having a negative effect on their health or to develop a new behavior. Another one of my favorites is a small group advocacy campaign project, allowing students to assess the needs of their school community and advocate for change on a topic of their choice. So lastly, it is essential that teachers build relationships so that they know their students and can feel connected to them and to the learning process.
Awesome. I'm taking notes here. I especially love the family exercise outing. I love that. So health educators are often trying to squeeze subject content into like a small frame of time. So what advice could you give a teacher to help them focus on kind of those important things for meeting the needs of all students in a small frame of time?
It's a great question, and I definitely understand what it feels like to have a small time frame to teach health. I had my students for 9 weeks, and it was really difficult to cover the content standards and practice skills in such a short period of time. So here's my advice. I would say first, have high expectation for student behavior. When students are well behaved, you will be more efficient as a teacher and can do more with your students in the allotted time. I would say second, consider the needs of your students. There never seems to be enough time to do it all and do it all well. So maybe take the time to decide what is most important about that particular topic for your students, and then be realistic as to what you can cover in the allotted time. Maybe cover some content, but spend the majority of the time practicing skills. Consider a flipped classroom approach for lessons where you want to cover a lot of content, allowing the students to be responsible for the reading that content at home, and then coming to class with background knowledge. And lastly, I would probably say get families involved. By informing families about upcoming lessons and topics, they can reinforce concepts and skills at home.
Awesome.
Those are some great tips. So here at Teaching Health by Any Means, we've been talking this whole season about my favorite health standard number 2. It sits with me and it lives rent-free in my mind. So this standard is analyze the influence of our family, peers, our culture, the media, technology, and other factors on our health behaviors, our life. And so just wondering, what parts of the health curriculum would you consider yourself to be most passionate about, especially when it comes to providing relevant learning experiences for adolescents, one of the most critical stages of human development?
It's a really good question, and I definitely think it's a tough question because I do feel so passionate about several different areas. But if I had to choose a standard, I'm definitely passionate about creating opportunities for students to practice the skill of interpersonal communication. I would say I'm intentional about creating opportunities for students to work in small groups to develop the language around health topics, practice assertive communication and conflict resolution skills, and create opportunities for students to reach out to families and trusted adults. Also, I'm passionate about the importance of extending learning home. Very early on in my teaching career, I realized I just didn't have enough time to do it all, to cover all the standards, practice the skills in 9 weeks of health. And in my first year of teaching, I created a series of homework assignments that I titled Let's Talk. And these were short homework assignments to engage families, extend learning home, and also strengthen support systems. These assignments definitely evolved over the years, and they're actually now part of our Goodheart-Wilcox middle and high school health program. And lastly, I just couldn't pick one, so I had 3. Lastly, I'm passionate about differentiating to engage all learners. I believe that when we meet students where they are based on their academic ability and their learning style, it makes them more motivated to learn and produce higher quality work. By providing choice, students can choose what's relevant to them, and it also makes them responsible for their learning. The use of choice boards and menus are just a few examples of how to differentiate my learning style. And if you do have a chance to check out our resources, you'll definitely see lots of examples of these types of assessments. So sorry, I couldn't limit myself to one, but if I had to choose a skill, I would definitely say it's interpersonal communication.
All right, we have graduation coming up. We have new graduates getting out into the workforce as educators. So with that being said, what advice would you give a new health educator, or what advice would you give your younger self along the way for attaining ultimate performance as a health educator or just an educator in general?
Yeah, so I've definitely spent quite a bit of time thinking about this because, as I mentioned, I'm no longer a teacher. I do now work for Goodheart-Wilcox, so I've thought a lot about what I would have done differently over my years as a teacher. And I think my first advice is to seek out opportunities to learn from and collaborate with experienced, passionate health teachers. Very early on in my teaching career, I didn't go to conferences. I think it wasn't even until maybe year 8 that I started attending conferences. So I would say my second suggestion is go to conferences, whether that's your state conference, national Shape America conferences, but attend sessions, especially led by Shape America Teachers of the Year. Get ideas and try them in your classrooms. Another suggestion is on your planning period, maybe sit in and observe another passionate teacher of your school, regardless of the content area. Look for effective classroom management and teaching strategies, and then try them in your classroom. Also, after each lesson, make reflection a habit. Decide what worked, what didn't work. Make changes in your lesson plan so that you don't repeat activities that didn't serve your students well. Build relationships with students. Both you and your students will benefit from these relationships. Another suggestion is advocate for a quality, up-to-date, skills-based resource in your school. Often if we don't take the time to advocate and ask for resources, then that money and those resources end up getting allocated to core content areas like English and math and science. And I can guarantee that these resources, if you do advocate and are able to get those quality, up-to-date, skills-based health resources, will save you so much time, allowing you to have that emotional energy to connect with your students. And lastly, if I could give my younger self advice, I would tell myself to join a social media group of health educators. I spent so many years creating my own resources rather than reaching out to others for help and ideas.
Great. And how awesome is it to have that resource that we didn't have 20 years ago with the social media aspect? I think that's an awesome bit of advice for anyone, not just a new educator out there. So thank you.
Your health textbook caught my attention as surpassing the standard for quality health literature and facilitating teaching and learning in health education. 21st century learning skills, just ready for all areas of learners. What would you like our professional learning community audience and professionals everywhere to know about your textbook?
So I would probably begin with both our middle, and I was trying to limit it to like 5 things. So I'm gonna try to limit it, but I guess my first is that our middle and high school health program is truly a program created by experts in health education and Shape America Teachers of the Year. It is aligned to your new Georgia health standards, but it's also aligned to the national health education standards. It's an up-to-date, skills-based resource, which is it's 2023 copyright, but at the same time, we still provide ongoing lesson updates for all teachers using our program, because we know that health is always changing and we want to make sure that teachers are always staying up to date. So we have committed to providing 2 to 4 new lessons each school year. I actually just finished a lesson update yesterday on fentanyl. And that's going to be released in about 2 weeks or so. So that topic is in our textbook, but new information is always coming out. Also, both our middle and high school program provide extensive Spanish resources to provide equity for Spanish-speaking students and really allow their families to provide support for instruction learned in the classroom. So we do have our textbook, which is available digitally in full Spanish. But actually coming soon, we are going to be providing our entire workbook in Spanish, our entire handout folder, and all of our parent trusted adult engagement homework assignments. It was actually just this week we released our middle school Spanish resources, and coming soon will be our high school Spanish resources. Our program is flexible. It's really easy to use with Google Classroom and also learning management systems like Schoology, Canvas, and others. I think another thing to know is that all of our documents are actually docx files. So we've gotten away from PDFs because we know that those can be difficult to use with teachers. And also it's difficult to edit them. So all of our documents are docx, which are basically Word documents that have already been formatted to upload as a Google Doc. And it's so nice to have a document that you can edit. And we do provide thorough training and professional development and ongoing support. So myself, and we have a team of individuals, it is really important for us that all teachers are trained using our resources and that teachers have a point of contact to come to if they need help at any point in time when using our resources. So basically, to sum up, our middle and high school program provides everything a teacher would need, from the bell ringer to the closing activity and more, so that teachers can truly pick what best meets the needs of their students.
Awesome.
Mary, thank you so much.
You're welcome. Thank you guys for having me.
Wow, thank you. Thank you. I know that information is going to be so useful to our professionals here at the professional learning community. It definitely was a blessing to me and Dwayne here today.
Yes.
You're welcome.
Before we sign off, just a friendly reminder, health class is for everybody. If you don't have your health, you don't have your life. Thank you for joining us.